And it looks like we're running. Ahoy there. Well, ahoy there, I'm TinyPirate and welcome back to Project Hospital. Hopefully the stream is starting to come online or something. It's... well, the game is loading at least. I have a hospital. Hooray, hooray. And now we see, is anyone going to join us today? So I had a little chat to the developers. They reckon I'm doing okay. We do need to earn a bit more money. We're actually ticking along. We're ticking along fine in that regards too. So we have a little bit of a few little jobs to do today. And it's going to take us a little second to get these jobs done. Why are you bad, primary stream? What are you complaining about? Why are you saying bad connection? Do I get a bad connection? I don't know if I do. Maybe I do. It seems, I don't know, silly thing. So the hospital is working fine. I did actually put some little doors in here and here to try and allow the doctors to get, and the nurses to get easier access to the wards where people are staying. Only problem is they tend to just like whip straight through. There is a shortcut like that, which is, I don't know, it's kind of weird to me. Hello there, concurrent viewers. And yeah, so that's a little strange. Now, if there was another tip, and I'm trying to remember it for the life of me, and I'm having a bit of a hard time. I'm not sure what it was. Maybe it'll come to me. Now, I need to have a little bit of a check of systems here, because on our day shift, actually, how far away are we from the day shift? I want to crack on for day shift. I think I've fired a couple of the staff here because we just weren't getting enough use out of them, which was driving me a little bit batty, to be frank. It was expensive running the X-ray blooming rooms if you can't really use them. Yeah, that's annoying to me. What can I do about it? Not much, but anyway, Project Hospital, I'm still quite enjoying it. It is still a little opaque in places, and I don't mind that. It's kind of amusing to experiment. I test things out and, you know, see what happens. And that's good times as far as I'm concerned. So what I want to do actually is I want to pile in upstairs and expand probably the general hospital. So, okay, here comes the day shift. I want to expand the general hospital kind of over this way a bit upstairs. So I'll show you upstairs. So this is the, where is it? General surgery department. And what I've actually done in here a little bit while I was off stream, because I was trying to make as much money as possible, is I've added at least one doctor's room and another whole lab. So now we have two labs, because what I noticed was you can see queues. We were starting, this dude was like backing up to sort of six people he was waiting for, which was no good. So if you don't know what this is, if you're new to me, I'm TinyPirate. This is a new tycoon game called Project Hospital. It's out on Steam. It still feels a little in the early days to me, like there is definitely some work the developers could do. I'd love to see hotspot. What? Not this again. I'd love to see hotspot overlays, but we'll get onto that in a second. This is a patient who's been diagnosed badly. So I can switch them onto our best doctor and then give them differential diagnosis. Diagnoses. Anyway, we always get people coming back, and I guarantee it's bloody nail fungus or athlete's foot. It's very annoying, and I have to prescribe them. Like, what would thorax percussion do? I suppose, I don't know, iron deficiency anemia. So, why we didn't... crumbly nail, athlete's foot. No, they're back to... Are we going to say nail fungus? Give her some foot cream and just send her on her way. Get out of here, you. Another... What was this? Wrong diagnosis. Nail fungus. We did actually correct it in the end. Crumbly. Okay, so he's waiting. He's doesn't speak the native language, which is unfortunate. Ah, these people are terrible. They're absolutely no use to us whatsoever, these bad patients. But the money is doing okay, and our star rating is okay. And under here we've got our goals. Treat 50 patients a day. Well, we're only going to get 40 plus odds and sods from ambulances, so we're not doing that. That was all done. Hospitalization is what we need to enable. Now, where were we? So this is our department. As you can see, no one's waiting. What's wrong with this one? Missing equipment, missing staff. Oh, we haven't equipped the cardio room yet. Do I want to? Well, I'm going to do the orange equipment anyway, which is this and this. ECG. We could do more. I actually need to get, where is it? ECG. That probably, yeah, see, it needs to go on something quite close by. I don't know, we'll see if we can do it. That there. So now the bed is enabled. We'll give them a medical light. An equipment cabinet here. We can afford this. This is okay. Oh, a lab analyzer, which isn't required, but it is nice. Oh, that's why it's in yellow. It's kind of a bit big on that table. Whoever the technician working this room is going to have to be a bit careful, or everything's going to fall off. So someone complained in the comments, just a random not YouTube watcher, complained that I spent way too much money on my hospital on decorations and stuff. And you know what? I do. I can't help myself. I like it to look pretty. That's why we're going to put a pot plant there, because that's just how I roll. Patient's been transported to another hospital, couldn't be treated here. Never mind. So you can see here we've got one patient waiting. Not exactly a busy day yet. I will hire someone with cardiology. So we'll spend that cash, because diagnostic stuff, no one. So this is where I hire people, if you don't already know, for the day shift, and I can hire doctors, nurses, technical people, and janitors. And I'm looking for someone who has radiology, or cardiology, sorry. And every time I click this jolly button, bam, that's more money spent. It's very annoying, because I get to go into debt. 25%. She's got two hidden traits. This one's a night owl binge eater. This one has a long commute, but is reasonably cheap. Yeah, we'll hire that one. Okay, so I'm hoping we actually see some use out of these rooms. We do out of these labs, less so out of the UCG room here, which is a bit of a shame. So we do need to then do some more stuff. So let me have a look over here. We can see we've got surgery, labs, we've got all these things. We've got cardio, so we're most of the way towards hospitalization. We do need surgery nurses and other bits and bobs. So that's what's going to be coming next. And we're going to expand outwards and upwards. We're going to rack up quite a debt to do that, I suspect. But that's all part of the fun. That's what's going to unlock ambulances for us. So walls are looking a little odd here. That's just how it rolls when we're doing this. When we're down here on the ground floor and then on the first floor. Good. So someone has paid. Oh, for the life of me, I can't remember the little tip. But I think this part is fine. We do have all of this up here to worry about or to consider. So that room is being used. Now if I go to radiology, let's have a look. We do actually have everyone hired, but look, this place gets very little use. A tiny bit of use, and the x-ray machine a bit more use. But let's see if we can get general surgery opened, and maybe we'll see some extra use. What I think I will do is I'm going to expand the foundations to here, just so that I can go upstairs and put the whole floor on. So you can see here, I sort of want to be able to add new floor. Can I just do it with this? Is that going to give it to me? It looks like it is. And I can do it to the edge there. Is that the right edge? No, I'm not going up. We're going down. Let's put a bit of wall on. I don't think that'll cost too much just to... Oh, it will apparently. So we better rack up some debt. Bam, 100,000 in debt. That's not too bad in this game if we make enough money and hit all of our goals. So we'll do that and that. And we'll worry about tidying up the downstairs another time. But for now, what we want to do is we do have these foundations. So we shall just do this. And that's that. I just need to be right back in 1 second because I see a small child of mine out of bed and they need to be frowned at and told to go back to bed. Wait a second, chaps. All right, and I am back. Now I'm just going to check something. Chat is... Oh, there is... I've got chat now. Okay, pop out chat. So my OBS client is supposed to be telling me about chat things, but it clearly is failing to do that, which is super annoying. So I'll just come back here and I'll just move my little windows around. Hospitalization and general surgeries are now... Oh, Lawrence, you're back. Good to see you again, man. That's great to have your advice. My windows are still being bananas. I'll get this in the right order. Okay, cool. Whew. So I think everything's working. There's 13 of you out there, which is good to see. So what we're going to do is knock down... Well, no, actually, we're going to just knock down these walls and get the walls in around the edges for now. I'm not the most efficient builder. Like, I like to lay things out and then figure out where I'm going to do things and how I'm going to lay stuff out differently. So that's this corridor on the upstairs floor. And hello there, Haim Sazan and Matthew Brown, good to see you. And yeah, great to have you along, everyone. If anyone does subscribe, then hopefully they'll see a cool alert. I'm hoping all my Streamlab alerts work. I don't know if they will. And another cool thing is I've got emojis and icons just about ready for members. So it's going to be a nice little perk for them too in appropriately due course. So I can actually now, I'm going to just cut this in here because there is a corridor running this way and I just like to be consistent about my sizes and spaces. We'll put down white floors because I know I want to build with all of this space. And not accessible? Really? Oh, well, that's not radiology. This is... what have I done? Have I done something weird? It looks like I have. That's strange. Corridor can go all the way up to here. Oh yeah, somehow I've managed to just delete those rooms briefly. But that's okay, we can figure that out. And yoink. And we'll fill this in with something else. Okay, cool. So then this one here is not accessible. Okay, fine. Cool, so let's get this up and running before we spend all this money on these people and we don't need them. So there's a few things we need. So we've got cardiology, radiology, a nurse's station and an on-call room, 4x3. We've established that these are a bit slim. So we have the we have the common room, not the on-call room. I'm actually inclined to put some of those waiting rooms here, and then I'll have stuff over here where there's going to be, like, it's going to be handy to the lifts, maybe? There's a few options, and they feel expensive. So high dependency unit. So the people are going to be based in the... So high dependency feels like it's going to be... fairly, I think that's going, not accessible, that's fine. I think that's going to be okay. And then actually nurses station, How many nurses do I need? Doctors, nurses. I need about the same number versus the on-call room for the doctors. We'll try 4x6 and a nurse's station. No, they're both 4. Is that really for 1, 2, 3, 4? I think we're 1, 2, 3. 4. I think we've established that I have no idea about the size of things in isometric view, so that's a bit of a shame for everyone. That. I quite like the idea of these rooms like backing onto these facilities. Like you'd think that that would actually kind of make sense, right? People need to, and a double wide. So that would be there. So people need to be able to come rushing in from the doctor's room. So PeepJS, yeah, that would, yeah, it's a pretty fun game. I've enjoyed it. They need at least one well, they don't, strictly speaking, need it. Feels appropriate to give it to them though. How many nurses' desks can we fit in here? 3 is right. 1, 2, 3. And in fact, really, if you think about it, the larger the room, the more efficient it can be because you can fit in for the same number. I'm going to give them decent chairs. For the same number of other accoutrements, you can fit more and more desks in. What else are we going to give them? We need to give them an wall-mounted equipment over the tray. That's nice and efficient. It's probably nearly enough, except I do not scrubs. I do like to give them a little bit more than necessary. A warming cabinet. No, we're not doing surgery, so it doesn't seem fitting. But I do know that I want to give them some chairs. Oh no, we want to give them printers. Where are the printers? Boy, I've lost them. Actually, maybe not, but we could give them some water. Could we fit? No, we have to fit that kind of there. And I swear there are things in here that I want, but maybe we'll just ignore them for now. No more printers or anything useful. Oh, there's some paper. Paper trays for a couple of them. And printer. And I have actually got sort of decoration bonuses for rooms before. It doesn't tell me what they're for, but it is nice to see that they're there. Hello there, Canada boy. Yes, we've just recently started up, and great to have everyone here. Doctors on call room. Oh, it's kind of not. I can't quite see. I've put the door in exactly the same place. If I move the door over, see, yeah. If I had the thing on the other side, now maybe we'll just put that there for now, and put one of the office desks there, so we can get sort of 3 doctors in, a PC for each. PC for each of the doctors that might come. No, that's. Oh, I've just wasted that money. Bloop, get rid of it. Couple of them can have printers, and maybe we will put in an office tray. How exciting for them. And these guys don't even get like useful, like cool stuff like the nurses with their trays and what have you. They just get boring old coffee tables and cabinets. We'll go for cabinet and maybe another cabinet. And then I'm thinking I might actually be generous and give them a sink and a coffee machine. We shall see. Oh, I feel like these guys at least deserve a bin. And the doctors can have one too. And see, litter free. I don't know what that means or if it's useful to anyone, but I like to think it's a good idea. And I'll accept thinking things are a good idea any day of the week. So doctors should have some posters to look at. Yeah, and nurses as well. Maybe one on digestion. Always helpful. And where is my bits that I'm... A kitchen sink. And I was thinking of giving the doctors a coffee machine as well. Maybe the nurses can come around and borrow it now and then. So that's quite a tidy little tidy little bit. Hey, Peep J, and you've watched all the previous vids. Nice one. Oh, you've already bought Shadow of Tomb Raider. Well, I've heard that's pretty excellent, so you haven't really done wrong with that. Now, these hospital beds are crazy expensive, the modern ones. More comfort. I'm actually not sure I need to give people lots of comfort now. I'm kind of wondering if I can fit 4 of these in. Life Monitor or Life Monitor Advanced. Okay. Oh, see, I can sort of hang that. It wants it there. Okay, so that's all the... And then the bed... It doesn't require, but it is better with a bed socket. So and I think I'll put a defib on the wall there. Only 1 per room is required, as has been pointed out to me. I'm going to try for... I'm tempted to try for several beds in here, but I mean, I can probably do 4. Yes, because this needs... Oh, I probably can't. Yeah. I could... Could I do 3? I can if I move the door around, which I'm actually okay with at this point, because 3 in here would be handy. So let's do that. There was a brief moment of thinking you heard. Sorry you had to put up with that. Does happen now and then. So we'll get this in here. And we'll put this, this can just go right. Does it make this desk unusable? It makes someone unhappy. Maybe we'll just put that there. And then we need a... Well, we don't, strictly speaking, need a door through from the nurse's facility. But it does sort of feel appropriate for a high dependency unit, doesn't it? So we got that, we got that. We need the life monitor and the overhead like that. So for a cheap room, this feels okay. For these waiting rooms, I like to give them... We're going for blue. I call it a kind of fuzzy carpet. I know it's not, but it'll do. And here we'll clean this up for now. All my labs have got the checks. The bathrooms have these little tiles. I'll come up with something else for the doctor's office at some point as well. So who else is chatting here? Your first live stream with me, Daniel. Oh, great to have you along. I've seen you commenting, I'm pretty sure. Great to have you here. Oh, thanks for being our favorite. Thanks for me. That makes no sense. Me favorite. Thank you. Very good. OCD kills in this game. Yeah, but it's nice to do things sort of well, isn't it? They spend most of the time checking on the patients. That's a good point. And the doctors should also be available to check. So we've got... we need to hire like so many people. It's going to cost so much money. Diagnostic unit. Yeah, this one I think can go down here. 5 by 4. Let's have a little look-see to make sure we can fit it all in. Sometimes these are... I'm going to try and line it up with this one. Oh, dialysis. Oh. Oh, it needs to go at the head of the table, doesn't it? Or in the corner, to be precise. So disinfectant. I'll just put it on this wall for now. Under the bin. Equipment cabinet can go here. Medical light. Did we get medical lights everywhere else? Yes, yes, yes. Those don't need it. Okay, so we do eye test. No, we don't need a stretcher. Mobile workstation. CPR scan and an odometer. Could... if I'd been sensible, I'd have just used the small one of those, which is a bit... I feel a little bit silly. But we'll put that there, put the CPR scan on it, and maybe we'll get one of these little equipment tables, because actually they need full access to that. So the stretcher is a nice to have. So I'm thinking we'll just put all of that here, and we'll put this here. Okay, so we better put up walls. I think we can fit it in, is the answer that we're looking for. So now we can do the door, which I tend to like putting here, and a stretcher can... It's actually happy with it there. Alright, fair enough. Is that a working room? I think so. Let me just do the floor. I want to make it my little blue checks. Wham, because diagnostic type labs are always checks in mine. Cool. 6 a.m. Dark Libertaria. Well, enjoy being awake. You can always put stretchers in corridors. I know. If it's an optional, it feels kind of like... So that room is happy. It feels kind of like they're asking you to... put on some proper effort to make it a decent kind of facility, I guess. So my question now is, do I fill in over here? And I sort of think I can. Like, can I put in this amount of upstairs? I'm pretty confident that I will need some pretty big space for these. So yeah, I at least need that space. If I go downstairs, it's going to look a little weird, but you can't ever really see the upstairs downstairs difference, except in situations like this, which I don't know why I don't have a ceiling here. I guess it's because I haven't built the second floor on, but that's fine. So we've spent quite a lot of money already. That's what I'm a bit worried about. So let's come upstairs and look here. We do want to expand our walls. So corridors are going to come, or the corridor is going to come down here. And I think a ward is going to be here, and a kind of an emergency space is going to be over here. So we'll have a corridor that runs along here, and then we'll have wards and stuff in here. So I'm gonna have to just delete a bit of that, and we might fit in something smaller. I have not played Hospital 2.0. I've heard Hospital 2.0 is a little bit more kind of relaxed and fun, simple, not so much of a simulator. This feels quite simulatory, if that makes sense. It probably doesn't. But whereas 2 Hospital is very relaxed. So general surgery 8x6 or 6x6. So you can kind of see, in fact, I'm really tempted just to use... No, that's not going to be general surgery office. We want the actual... No, we've got diagnostics and high dependency. An operating room, which is something like this, just to give you a feel like that. I'm actually kind of inclined just to plop that one down because it's a pretty fantastic room. The game is a time killer. It is fun though, I like it. So you can see how beautiful that room is. Let's just use that. And over here, see the wards are regular ward. It's 12x6. So you can see this ward here has 4 chairs. It's actually a little bit, I don't know, it seems a little bit overkill if you ask me. And it would totally fill our space to do this. I could, however, configure a ward that was sort of more over here. And that feels a bit more sensible to me. So we're going to do that. Let's give ourselves a couple of squares space. And then we can put down and knock down some walls. And we'll have a bit of corner space for a cleaning closet if we don't have one in this area already. That will be always appreciated by by our staff. And when we're feeling a little bit more flush with cash, we'll fill in the downstairs and make this place just generally look, because look, I don't know why it does this. Like if I put the walls up and come down, yeah, you can see this. I suppose I mean, I guess I could, you know, I could come up one and put in a floor like that, and then when you go down, what? Yeah, I don't know either. I don't know why it does that. So that's fine. We'll just get rid of this and start thinking about, I'll just throw this wall in here. So the ward does need to be fairly substantial. And I'm thinking like that is not an unreasonable size for a ward, if you ask me. Hello there, Ethan Colt Games. Great to see you. Good news, I've got all my what is it, my fantastic like emotes and stuff, badges coming very soon, so that's cool, and that will be nice for those who are members like Ethan. Thank you. And Ethan, I should say as well, if you join Discord, then I'll be able to give you a role, and that's like not a weird thing. That means I give you like a special permission, and you also get to join, what is it, you also get to join channels where you might win prizes and keys and stuff. So let's have a look at what's going to be required for this. The bedside table goes on the left. One wall defib is fine, and a socket is kind of all. So like we can cram them in here. Like 1, 2. I'll give them a bit of space. Like 1, 2. Oh, okay, we kind of broke. Maybe just a teensy bit more money. Thank you. And I'm actually wondering, would we be able to fit? We probably could fit more patients down the side, especially since we're doing cheap. Here we go. We're doing these cheap beds, which save vast sums of money. And we're being kind and giving them bed sockets just to help them stay alive and be happy and friendly. Wish you prefer to build MRI first or the ICU? MRI. Oh, you're just figuring out how to use Discord. Awesome. MRIs are so expensive. And I don't see them being used straight away. Oh, that's kind of a shame. I can't quite, like, does it? It sort of implies that it needs to go in, but I know it doesn't. So that's a little unusual, I guess. And one of the things I could do is give them like a fancy, it's not like you'd think you'd be able to jam something in just to allow people to come visit, but they don't really seem to care that much about that. And I am extremely broke, so I think we're just going to leave that for now. What I do need to do is sort out the corridors though, just at least to get us this far down to here. We can probably ignore this space. We do need to think about, do we need anything else? Like there's a cleaning closet down here, there's a toilet down here. These patients come and go from toilets all the time. Got enough stretchers, USG. I'm actually, yeah, I think I will make this a toilet upstairs just so they're not wandering the floors like crazy people, which they do seem to enjoy doing. So all the patients can get out of bed and go to the bathroom here. And am I going to give them 1, 2, 3? Am I going to give them walls for privacy? I think so. I can't. I just feel bad if I make them like poop on in public. I did that in one of my other videos. It was funny, but I just felt weirdly bad for them. Kind of dumb. Sinks, yes, and we'll do this weird thing where I can just jam the hand dryer straight over the top, and that's a toilet. Now what I need to do is hire people. That's that. Doctors during the day. It's gonna be, what do they need? The doctors need on-call room specialized in general surgery. A fellow with advanced diagnostics in general medicine. That's actually pretty... Oh, a surgeon would be good. Operative surgery. 2 hidden traits. Let's look at them. Germaphobe and depressed. But you're too good. You're a very depressed surgeon. That's our house. Fine. He also counts as a doctor, so we only need 2. Oh, we need an anaesthetologist if possible. Now I'm going to have to hit the refresh button a couple of times to find my anaesthetologist. That's a... Wow. She's amazing, the specialist. Wow. Anaesthetologist? Come on. Come to me. I don't want to spend all my money looking for you people. Oh, man. It's going to drive me botty. Nope. Anaesthetology, you'll do. I don't even know what your other trait is. We're just hiring you. Good. And now we need one more doctor. Your patient's only 30 at this time. You'll get more patients too. I like using 1 or 2 ICU beds to start before the MRI bed goes in. Yeah, that sounds sensible, Lawrence. That's still a good sized hospital. Yep. What should we do to increase attendance? You have to go through the quests, basically. You have to do all of the little side quests that they require. I'm going to choose someone a bit cheaper. So, general surgery, 1710. This resident seems 2110. This resident seems good. Nurses. What do our nurses need? Patient care. So, what are your hidden traits? Good boss. Pleasant. Alright, you'll do. Another one. 19% patient care. 46% patient care. But she's slow. She's also able to help with medical surgery. Sorry, William. That's my biases playing out there, sorry. What else we got? Patient care, clinical nurse. Why not? You're not broken and depressed. Okay, good. Now we need to hire a night surgeon. So we don't need anyone at night, and I don't even think they do surgery at night. So I'm going to try and hire a cheap night doctor, considering we're already broke. 270, 273, 15. So a resident for night shift, practical diagnosis and loyal. Yeah, I think we'll take you for 270. Oh, okay, I think you'll come back. I'm relatively sure you'll come back. So a nursing intern, you sound amazing. Oh, she's actually clever as well. So yeah, you can come back later too. I will check at night time to make sure. Oh, do we really need a nighttime shift desk space? Which is a shame. I will have to leave this. We'll put this here. And I'm going to have to put another desk in here for her. I think they do. They need their own desks. No hot desking in my hospital, which is... Oh, God, we're broke. I have to up that. I hate spending so much money. It's really easy to spend just way too much. And I still need to get an ambulance. Alright, so we're going to have to give her her own desk, which bugs me. She comes with a stereo though, so that's good for her, isn't it? So where are you, staff member? Come back to me. And you were the one without a desk shift. Okay, we want you on night. And we're going to give you a desk, which is that one. Okay, so we should come up. You're not a doctor? Oh no, she sat down. Oh no, Judy, you're on night shift. Go home. Get out of here. Bad news, lady. Oh boy, the night shift can share desks. Oh, that's weird. Like, I had to hire her first and then switch her to night. I see that she did actually come in. Ambulances bring 2 per quest. Yeah, I don't know about that. They can do surgery at night. We only do it once a hospital's about 50 patients. Oh, night shift can share desks. It's weird. But, I mean, it's not so bad that we've jammed them all in there. So I'm just checking here. That's all green. That's all green. We should be enable hospitalization at general surgery department. So now, in theory, I can hire or buy an ambulance, right? Do I want to? Where was it? Oh, not yet. It looks like it's not yet. So let's run it for the day. Or for the evening, and let's see what happens next. Yeah, I think I got it fixed in the end, didn't it? What? Can't be hospitalized? He's got IBS. Why do they need to be hospitalized? Why can't I send him to the hospital? Well, he's having a ton of work done on him. Oh, hang on, he is hospitalized. Okay, so that was weird. That must have been a very early alert that we got through. Yeah, we got through all of those. No, she's fine. So let me just check. Has she actually got a workspace? Yes, that is hers. Yeah. Oh. Okay, that feels a little buggy. Something went weird there. Oh, she was assigned but didn't want to be assigned. Oh, here's my ambulances. So, you know, can I, like, I mean, should I buy an ambulance? I don't know, actually. I haven't got this far before. What do you chaps think in chat? Should I go hire an ambulance, buy one? They are 34,000, which is expensive. But this is working okay. We have like the most austere hospital room known to man, but we can at least double it up to some ridiculous, like jam them in at eight people. I'm a bit worried about the cleaning. Seems okay so far. Hey, having a little chit chat. The intern and the junior doctor, keeping people alive. Excellent. Do we need more food machines? Probably, but yeah, let's have a look. I think we probably do. Food and probably a water cooler. That's probably fine. Yes, they give me 2 more patients. That is a good idea. That will pay off. So, ambulance. And they go. Don't have a... Oh, is that that's the parking lot? I hope they don't come in over there. They don't come in over there, I'm pretty sure. So let's just up the amount of money we're borrowing and get that ambulance. Come here, ambulance. What is it? 35,000? Only placed outdoors? That... Oh, I see it. We're 2 levels up, so it got very confused. Maybe? Oh. Can we just... Outside of... Can't be placed outside hospital property. Oh, now you're being weird. Okay, game. There you go. Bam! Purchase an ambulance. 2 more patients arriving per day. That's more people to disappoint, as far as I can tell. And I can't even see it. It's always going to be a ghost ambulance, which is a bit of a shame, but what can you do? Okay, so this is all working fine. Even out. We got enough cleaning going on. There's a bit of dirt around, but these cleaners aren't doing too bad. No one's in our trauma center. The rest of the place is looking okay. It's very quiet at night. Except for the people on night shift who just... Look, she just sits there talking to herself about doctoring. Yes, or flying a kite. I like to fly kites during my off hours. I go flying in the middle of the night. I can't see the kite. Very fascinating conversation you two having. Brilliant. All that's working okay. How is the contention on this lab? Oh, is that 100% workload at night? That seems weird. And during the day, there's nothing in here. So we'll have to wait for the day shift to happen, which we can speed up. Oh, and see you later, Matthew. You can always catch up later. It'll be on the channel. And okay, objective complete. What is our next objective anyway? Treat 10 patients per day at general surgery and we get a $50,000 grant. Well, that's going to go a very long way to fixing things up for us. And that should be pretty straightforward. No, we've got them. Internal medicine is the next one we have to worry about. Oh, okay, doctor's rounds. They're sitting down, playing solitaire, waiting. Oh, that person left. $300. We are richer. And all of these people will eat through that profit very quickly because they've got nothing to do all day. Which is a bit of a shame. Now, the ward down... See, it's these nail fungus people. Oh my god. Like, I think we've got it right, finally. Can we switch them to, like... Go to general surgery. I don't know. Have more doctoring. Waiting, being called. Fine. I mean, what are we going to do for you? You've got a bloody rotten foot. Take it home. Give it a wash. Where is she now? What does she do? Oh, she's seeing the doctor. Doctor's like, stop being such a gross monkey. Put some powder on that thing and take it away from here. Fulfilling needs. So she's gone for what? Wait. Now she's waiting. Going to doctor. So she's pretty unimpressed with us. We can send them home or send them to a different department. Okay, they're going now. And I'm pretty sure we've treated them. So we shouldn't have any more of their nonsense. Who is in here? So I should keep an eye out because the ambulance will rock up. So this person's with interstitial nephritis. That sounds disgusting. Would it help? No, we don't need to do any of that. We just need to treat them. Diagnosing a patient proved to be too difficult for this doctor's skill level. So we can do... Oh, whoa. That's a lot of stuff to worry about. So we can tell them what to do. Now let's give them... visual acuity. No, this is all kidney stuff. Yeah, I mean, we should do like... We should palpitate them. Let's do it. And now we should... we should go collect a stool. Look, there you go. He's gone to poop and he's going to come back and hand that. Should slow it down a little bit. Where is he? He's handed that to the... He's going to hand that to a lab tech. Yeah. What is he doing? Waiting. We could ask for a blood draw. And a differential diagnosis. There we go. And what's happening here? Egg blood. Is there a previous episode for this? Yes, so the last live stream on my channel, which is probably the last video up there. Yeah, I think it is. Will be the previous episode for this. And what was he doing now? Going to the doctor. Hanging around, kicking his little legs. Come on, let's get these physical exams done. Triage in the reception. So the green ones, I think, is what's happening now. Oh, patient's collapsing. Who's this one? Collapsing. Okay. So the doctor's going to take over. Probably has something pretty serious, but I'm trusting that they'll be okay. So we're just going to let them crack on with fixing that chap. And too long wait for a bed. Well, I'm sorry. You're just going to have to either be sent home. Where's this one? Oh no, he's lying there. That's fine. Undergoing hospitalization, being treated. What are they giving him? So active treatments is an IV infusion and hospitalization. So should be, and this is kind of interesting. If you see this, you can pop out the symptoms. Collapse symptom, and it tells you, so abdominal pain is the thing that's, and heart palpitations have been suppressed with drugs, and abdominal pain remains. So they should be okay. Well, we've got our bloomin' specialist on the job. They should be perfectly fine. So let's go back and check out on Mark Lee. So where physical examination. Oh, I think he was just waiting there because it was player controlled and we hadn't told him to do anything. So he's just hanging around. Linda, you need to get on with it. Get in there and treat this person. Oh, so there's actually, so the start of this map is the last game with Project Hospital. There's a blue background as the thumbnail. And prior to that, there are some other videos which I did where I was a little bit terrible. Recruit intern doctor pirate. I don't know if there are any doctor pirates out there. I'm interested what a intern would do. Like, I don't know why they have the interns. Ambulances have nowhere to... Oh, I see. So he should... Oh, I could put him in the general ward. And we'll put him in high... Yeah, we'll put him in that one. Are they going to actually move him? Just going to leave him there. You just stay there, pal. Get rid of the regular hospitalization. And someone take him, please. Okay, we'll go check on the other one. He's not being taken. Does that tell me anything? Default patient. Why are you not being looked at? Right, these are two quite different things. Actually, what's he doing? He's going for his... Oh, we're going to run out of time in the day. Actually, should go check the... What? Okay, well, I think we've left him under enough control. He can come back. Let's check this one. Ugh. Endocrine pancreatic insufficiency. The gland is damaged enough to cease functioning? Cease functioning. Not seize. That's fine. The devs are foreign. Normal absorption of nutrients, blah, blah, blah. PERT. What is PERT the treatment? Oh, okay. PERT. Do the PERT thing. And, like, take some rest and change your diet or something. And have some vitamin supplements and some analgesics. Just, we're going to smash you. Why are you still there? Oh, we might be short on beds. Oh, no. Leave. Let the doctor try. Okay. Are we short? Oh, my goodness, we are. We need to urgently add more beds to this facility. So we're cheap. So we don't go for fancy beds around here. We go for the cheapest possible bed. I feel a touch bad. But, you know, that we're not exactly made of money. You know what? I'll be generous. Never let it be said that I don't know how to treat my patients. They can all share a single TV. What are the events? I have no idea. Like, I think we're going to have to wait. Lawrence will know. So, yes, we'll see what happens. Hey, if anyone hasn't already, do subscribe. I'm really hoping I'll see a cool alert happen from Streamlabs, but I don't actually know if it'll work. Likewise, if you super chat me or if you join as a member. Well, Urgent Echo is because we don't have a... What is wrong with you? It's always lupus. Well, I think it's because you're stuck in emergency. So can we send you somewhere? Oh, no, you're stuck down there and we can't... I don't know why. Can I... Oh, I can. If I actually take player control, I can send her someone else, somewhere else. No, what are you doing there? Get out of here. No, what? Regular hospitalization? Okay, no. Let's take these one at a time. So what is wrong with you? You've got chronic kidney disease. And do we need to send you to the HDU? You need dialysis is really what you need. That's actually ongoing, is it now? You're in bed, asleep. So the treatment for this is dialysis. So that seems fine. So I don't know why you're complaining. I think you're okay. You, however, Jessica, wherever you are, we don't know what's wrong with you. So we need to run some, like, just do all the tests. Yeah, let's smash all of them. Why not? Can I transport you over to someone who isn't terrible? Maybe the specialist in hospitalization. Oh, yeah, well, like, get her out of there. Bed is required for examination. Urgent echo. I think that's because we're on night shift and we don't have any... Yeah, look, those are fine. We don't have any night shift people on echo. Who's that? Okay, that's good. He's sitting there doing his, you know, having a bad life. That's fine. And I think she is going to stay down there, which... Oh, no, here she goes. Where are you going, Jennifer? Oh, no, that's... Actually, no, where are you? Oh, you're in the HDU as well. Wow, poor old HDU is being smashed. A streamer had a copy of the game with a mass casualty events. Oh, my God. Yeah, you... Whoa, ambulance. Okay, so I think we're going to have to wait for morning to see if she turns up. Where's the ambulance? Where's the ambulance? Did it just turn up and go? Because we're on fast forward. Oh no, monitored patient is heart failure. No, we can't. It's night shift, so we can't put them to that doctor. Like, you're going to get who you're going to get. Oh, here comes the ambulance. Alright, let's slow this down. What have we got? Oh, this chap. He's been in some kind of car crash, I can tell. Critical state. At least one collapsing abdominal injury, blood loss. So fast. We don't need that. We need blood transfusion, emergency care, and fast sonography. We'll do that. I mean, I think the doctor will do that anyway. They're just going to go in there and mop up all the blood. He's lying there on the table. Everyone else is like, yeah, whatever. Where are you, doctor? Where are they? What? You're in the... You need to go to the ICUs. Oh, we don't have an ICU. I think all we can do... an ECG and defib. Like, can we... I think we're going to have to send him to another hospital. Yeah, another hospital time. Sorry, pal. I don't have an ICU. I don't have an intensive care unit. You're lucky you're even here, to be frank. Well, not very lucky, let's be honest, because we have to send you away again. Thorax percussion. Well, I don't know whether... No. Okay, sorry. We let the doctor take over from now, I think. And cross our fingers. They're all just like, oh yeah, hey, how's it going? No, yeah, I can see you're bleeding out on the table. Alright, so it looks like we've got emergency care underway. I think that's what the flashing means. Blood transfusion is coming. TC hospitalization is... So you are the nurse. What are you doing? Performing procedure. You're the doctor. Okay, so I quite like this kind of detail. Like, it does matter that you put equipment where it is. Oh man, this guy is in real serious trouble. Where is... So I don't know if... So satisfaction high should be good. But if discomfort is all the way up there, is that bad or good? Like, it's low discomfort, high bladder? I don't know. Hungry or not? Severe hemorrhage, suppressed. So the black ones are suppressed. Open wound has been treated. Abdominal guarding. Operating room and general surgery department and an ICU. Like, I'll put it down, but I don't think we can do it. Let's smack that one on. Actually, oh, liver laceration. Oh no, we'll smack all the things. And where's he going? Transported to room. The interest rate is, let me have a look. So basically it's kind of a 1% a day. So it's a fair amount. But yesterday, I don't know, we lost money. The day before, we spent vast amounts of money. Let's just not look at those numbers at all. And where did he go? Oh, he's in there. He's in the HDU. Our HDU is already full. That is a shame. Blood transfusion and hospitalization. I think we're going to have to kick him out. Because we don't have an ICU. And we're a little bit away from ever having one. And all these beds are occupied. And we're broke. So I don't want to get any more in debt. Oh, see, look, they all hop out. 3 of them are going to go to this toilet. The rest of them are just wandering the halls like zombies. I'll have to ruin another room down there before they jump back in bed. We need to move some of these patients on. And he is a worry. William. Like, what are we seeing here? Clinic opening hours are going to start. So he's got these active treatments. We're proposing abdominal surgery. We don't have an ICU. Is anyone actually going to go check on you? Don't know. Idle in bed. Well, you're getting a little happier for some reason. I don't really know why. Huh, there's a lot to think about. Which department would go back to money fast, Felix? I don't know. Ah, yeah, Snake Skin out. 1 Hour 1 Life is one of my favorites too. It's such a clever game. But it makes me so anxious because you only have an hour to do everything and it's hard to fit everything in that you want to do. Yeah, once you have loans, you start earning it back. Yeah, that is right, Jacob. Cardio or neurology, he won't need an ICU unless he crashes. Well, yeah. Let's... Pressure bandage. I mean, maybe he'll just get better. With his lacerated liver and his severe bleeding and his open wound and his abdominal injury that was stitched up. I want to have a quick look here at general. So that one is actually reasonable. That one is busy. Over here, 20% and 11%. So I think that's the general surgery open. These are busy. This one has someone in them. We haven't had to do a general surgery yet. And I don't know when do we do general surgery over other kinds, like over ICU. I'm not sure. Ah, here we go. We can see what's happening here. Performing a procedure. No, not you. I want to see this guy. Oh, so it is William. He is going to get... Okay, well, I treat 10 patients. $50,000 grant. Okay, let's just drop some of our loan for now. So, okay, oh, this is kind of cool. Like, we're going to just watch this fairly slowly because the surgery is pretty great. They've cut him open. Anaesthetologist is working, checking on them. Scrubs are on. Their little tiny wooden little stick hands are working away. Got a nice little gaping hole. Blood is splattering. Nurses are attending. This is pretty awesome. I do think this is great. Ah, we're done. Someone else wheel them off now. We can rock star our way out of the room. And how is he doing? I mean, what's it? Hospitalized, treated. It's going to pay us tons of money after treatment. Blood control. Post-surgery blood control. Why not? 3,900. I think. Does that add to the cost? I hope so. We're going to rack up those big bills for this chap. He's our money. He's our meal ticket. He's paying for everyone's salaries. Just take it easy with stuff at first. They cost a lot of money. They do. This isn't the hospital from the very first playthrough. This is the hospital from Livestream I started on Monday night. It's Wednesday night here in New Zealand. So, yeah, I have done a little bit of work. It's about the same place, but I'm not so ridiculously and utterly broken. Transported to a room. What else is required? Oh, liver laceration, abdominal surgery. So I guess he's going to go back in for more surgery. We fixed the first bunch, and now we're doing the next bunch. And I'm expecting to see him back here. Hopefully before too long. Transported to examination. Oh, okay. So, yeah, have a look at the guy. How are you doing? Yeah, you're still miserable? Oh, yes, of course you are. Back into bed again. That's a very tough life for this chap. At least he's asleep. Oh, someone's arrived by ambulance. Who's here? What's this one? Oh, is this endocrine? This another endocrine. What's the face? Well, I know they're going to prescribe PERT to him. That's the recommended sort of thing. You're hiring a talented intern. Oh, that's a good point. I mean, I should keep an eye out for them. They do come up as hiring options. The overnight staff at interns are very cheap. A special skill. That's cool, Felix. I haven't seen that. I mean, I know I get them. It tells me I get them as quest rewards. Lyme disease, chlorine gas poisoning. That'd be brilliant if there was one. Pertussis. Oh, right. Yeah, that's disgusting. Whooping cough. I had that. It took me like 12 weeks to get rid of. Even though you're vaccinated, you can still get it. Shockwave lithroscopy. All right, we'll leave this up to the doctors. Mark needs some... What are we doing? I guess they're suppressing and they're examining. Oh, renal contusion needs IV nutrition. Oh, that's pretty easy to fix then. General surgery department. Good, so he's off to general surgery. So if you don't know already, there's actually quite a cool flow diagram here. Right now you can't adjust it, and I wonder if it would ever be useful to adjust it. But you can see if someone comes in a mobile, they go to the trauma center, then maybe from there, or they go into the observation room if they're coming in from the doctor's office, like if they're not horribly like hospitalized. But if they are, either way, they go to either ICU or to hospitalization, and then they go through various treatments, surgeries, so on. And people can also be in the clinic for a checkup, so they can, I think sometimes, I don't know if you regular ward, you're stuck there and then you're out, but you see people come to the doctor's office, then to surgery and so on, and sometimes people go off for checks as well. That's how that works anyway. This guy has been in World War II. This game has a big issue, Josh, and probably what you're going to say is the waiting. There is a bit of waiting, and it does drive you slightly batty when you don't have money and you're kind of just waiting to see things through. 50 patients a day. We would be better if we actually hit those. 80% prestige at the end of the day. Well, we're going to do that, which will give us... Next 2 interns available for hire will be great. Well, that's good news. Lack of camera rotation. Well, yeah, it is a fixed... it needs more gameplay. It's a fixed isometric. And I guess they could figure out how to rotate it so you could see around your hospital. But I figure they're just not trying to overdo their... not trying to overdo things. And they want to hit the basics, which is to get this game working as it is. It's looking dirty in here. And we're running out of money. Too long for an examination. Well, where is the doctor? Where are you, pal? Are you upstairs? You must be upstairs. Oh, here we go. Click on you. Oh, you're being transported. Oh, you're actually being transported, so that's okay. Urine sample, is it going on? You're in hospitalization. You were in TC, and now you're asleep. So forgive us, shy, likes to hide delicate symptoms. That's cute. Forgive us if we don't look after you while you're asleep. Use cheat engine to bypass the waiting. You can also unzip the save file and mess with the loan amounts, the developers told me. Well, I think the events could be really interesting. Gearing up for certain kind of events and having some warning that there might be a disease outbreak. I could see there being like zombie plague outbreaks, maybe with quarantines, all kinds of silliness. This is a very full ward, which makes me think I kind of need to crack on and spend some money. Let's go back up to 200,000 in debt, because otherwise you guys are just going to watch me stare at the wall, and I can probably do that on my own time, right? Like, YouTubers can just stare at walls all day long when no one else is watching. Did I line that up right? I did. 1, 2. I will. Can I fit? I can't fit a sofa there. We'll give someone a little bit of a chair sitting down space because we are again. Oh, I forgot the traditional potted plant, and we'll put one. Oh, either side of the fern. How fantastic is that? So that's even bigger, which is good. That should help. Take the full line. Then, when you need the profit objectives, fire the staff before midnight and rehire. What? That's totally annoying to do. That's understandable, but very annoying to do. How strange. I would do that, but I would feel terrible if I did. Alright, I'm just going to check something. What are my stats? I've got this, where is it? Dashboard, chatbot, no, editor. I'm still live, aren't I? Except this is being weird. Studio mode. No. Oh, okay, back to the game. Okay, cool. So that's not being strange. So I'm trying to get the chat thing to work properly for me in the Streamlabs streaming software, and it's not doing it right now. So let's do that, and then go back to Project Hospital. Okay, so the place is actually looking really, really dirty. So actually one thing I do want to do is I'll probably just hire a overnight cleaner. Who's cheap? You're cheap. Yeah, we'll have you. So what I want to do is check our goals. 80% prestige. So I just want to... Why didn't we hit that at the end of general surgery? Oh, did we fall disgustingly? We did fall. Ah, that's so annoying. Before midnight, drop the loan amount as much as you can. Well, I had a lot of janitors during the day. I didn't have an overnight janitor. So I'm hoping at least one fixes it. So if you look downstairs, like there is... Okay, clinic's open. You should see a fair... Oh, hot ambulance is here. You should see a fair number of janitors kicking around. They will go and clean beyond their area. But not right now, it seems. Their areas are pretty big. None of you going to be hospitalized? No? Oh, what? Where's it going? Why did you... did you just sound the siren to come home? That's pretty lazy. So we've got someone collapsing on the ground in emergency, but we do have Linda, and she is a specialist, so I trust that they will be able to figure this one out themselves. And what I need to look at is the requirements here. So open internal medicine department clinic. Trauma center hospitalization. Oh, there's... Can we get rid of her? We're going to have to wait. They're treating her. Like, they're examining her and doing all the emergency treatments, which we have to let them do. They will take her as soon as possible. The cleaner's just in there scrubbing the floor. Okay. Can we flip you to another department? And then we can get someone else there. What barium swallow? What is wrong? Fistula of the intestines. Ugh. Okay. Ugh. Oh, that sounds disgusting. It's one thing I'm learning a lot of horrible things I never want to have to face. So these are not good. She's collapsing. Why can't we send her to... Where is she now? Okay, so we can we... Okay, so TC hospitalization. There she is. Good. So now she's in trauma care. She'll be stabilized. I think that's how it works. And then fixed. Okay, good. Phew. Drop the loan amount. Get another trauma room. Need at least 2 of them. You know what? I think you're exactly right. I think you are exactly right with that. It seems like it keeps being a barrier for us. So let's have a look. I like to borrow these ones straight off the shelf, I suppose you could say. Trauma Center, 23,000. Whoa, they are so expensive. But I'm gonna use a prefab. I'm not ashamed of that because I do want to crack on with the other jobs we want to do. So we're just gonna put one right there. Doesn't require any staff. Yeah. Not enough trauma rooms. Yeah. At least 2. Let's see how that goes. And ICU. So the requirement is that we need internal medicine, and internal medicine is this one here, right? So internal medicine to me could easily fit down here. What does it need? Waiting rooms, and a bunch of other things. But internal medicine office and a waiting room is all that strictly speaking is required. Actually here would be better because it's very close to this. Well, this one might be, internal medicine feels like somewhere where I'm not going to go for emergencies. Got it. Thanks, Daniel. Yeah, I'm getting there. It is a little, the game is still a little new to me. Well, not a little new to me, but when you're YouTubing, you don't actually have that much time to play games. Ironically, It's like a Star Wars meme, isn't it? He could play the games, but he couldn't play himself. I don't know, that's kind of lame. Shut up. No, we are going to be short on cash. Well, I mean, we can get a loan, but I'd rather do this a little cheaply. So let's have a think. Internal medicine needs a internal medicine office, and it needs a reception. And it needs a waiting room. Well, it needs a waiting room at least. So let's just thinking if we went this way with a corridor, keep the charge above ER for your radiology. Keep the change above emergency room for your radiology. Oh, keep the space above them. You mean so I do have some radiology going on in this vicinity. I don't mind expanding it this way, but I could put I could put the very basics of this internal medicine over here, like hospitalizing. I could put the internal medicine office, which requires was a 4x4. So I could just give them a 4x5, a bit narrower like that. And I'm sort of inclined to jab a corridor down here. Oh, you know what? Let's rotate this room slightly. Okay, so let's do the corridor first. So that would go all the way through to there. You'll eventually see. Here... Oh, that actually... Yep, so let me scrap that room. Okay, so and the corridor will go like this. And internal medicine will have a corridor that goes here. And I need to buy the ground I'm on. Like this. Like this. I know it's a bit too much space, but it's just... I get really antsy about things being weird or wrong. So I don't want to like lay out things oddly. Okay, so they've actually got, there's enough room for like toilets and stuff there. There's enough room for something big over here if I need it, and there's enough room for reception here, and a waiting room that can probably wrap around the cleaning closet. Wouldn't be crazy, but let's just say that there's a waiting room that goes like this. So this can be the waiting space for internal medicine. We'll give them the fancy informational TV here, the Q machine here, and some chairs like just along here. We'll take down this wall for now until we figure out what we're doing, and we'll paint the floor. What is this color? Actually, what color is internal medicine? Kind of greenish, but I've already got greenish for x-ray, so I should have chosen orange for x-ray. So that's going to be internal medicine. There should be some... want to make this a little bigger. Just so it doesn't feel quite so claustrophobic. There might be a reception, but it's probably not necessary. Internal medicine office. I'll give it a little room for a reception. So we can do 5x4 because I can 5x4. Hang on, is that really? Gosh, no, that seems wrong. Let me start again. Let me scratch that. So we'll give them the internal medicine office. There we go. 4, 5x4. Cool. Let's see if we can jam everything in. There's quite a bit to jam in. Okay, so we need a wall, at least some wall. Okay, cool. I'm just going to check what everyone's saying in chat. Not enough trauma rooms, got it. Probably want to keep the space right of that corridor for other ER rooms. Eventually you're going to need them. Yes. I mean, I can fit one in here, and I can actually fit all the way down here. Can have a ton of ER stuff as well. Let's get this in. So I want... the defibrillate, the disinfectant, this. The eye test can go there. The door will be going here. The mobile equipment will go there. Spirometer expire. Okay. So we need at least 2 tables of stuff. Where are you? Office desk. We can do that. Oh, we actually need that piece of paper apparently. Definitely need a PC and a chair. And then examination light. I'm going to hold off because they're a real pain if you get them wrong. Equipment. CPR scan. And some kind of cabinet or just a... Where's that little equipment desk? No. Yes. And... come here. Why are you... so strange. Wait, does this... No? Is that happy? No, that's unhappy. No? Okay, so that's being odd. Where's our little... maybe our little bench can go in. There's a little bit of jigsaw. No, what did I... What on earth did I put there that it's unhappy about? Hang on, could we just put... No, that's... Okay, that's confusing the heck out of me. Why can't I fit my little wheelie drawer in? Oh, I can fit my little wheelie drawer in now. Where are we going to put the audiometer? Emergency rooms. A tiny room. Put 4 trauma centers. Yeah, that's a good idea. This I want to be a little bit... This space here I want to save for cleaning rooms and bits and bobs. Where am I going to put this stupid stuff? I can put that way without any major problems, which means I can put another little equipment table here. And then I can put the audiometer there, and the medical light there, and I can put a wall around this to make it like not totally... I put the wrong type of wall. I like the white one. I'll worry about colouring it off air, I suspect. And I'll at least give it some white floor tiles until I decide on a final colour scheme. Yeah, we'll just do this and do that and take down the walls here. And then I think the internal medicine is almost open, as ridiculous as that will be. Needs a doctor, so a single doctor. Attending resident, attending fellow, and they're going to need internal medicine. Do they need anything else? No, not really need anesthesiology. No hidden traits, and is a hard worker. Great, doesn't take breaks. Bam! We can get patients. I'll have them. Right, where are you? Yes, give me patients. In our weird open air office. I know, it's a bit strange. Do we want to mess up with it anything? Good question. I will decide that in just a second once I've clicked this, then clicked that, then clicked this in the other window, and then come back here. So, oh, actually someone got treated. Who was it? Infectious whatever. EBV. Epstein-Barr virus. Ugh. Kissing disease. Sounds disgusting. Where is he going now? Going to chair. Oh, okay. So he's going to wait for an x-ray of their chest. But we already know what's wrong with them. Are we just racking up the high-value treatments? Shameless. And clean feet. Well, that's fine, I suppose. And more people are coming in for emergency treatment. So there you go. We do actually have 2 trauma centers running, which is good to know. So we should be checking what we're going to get. Treat 1 patient a day. Hospitalization. Wow, I don't know if I want hospitalization. But fine, I guess I'll take it. Oh, monitored. What? Oh, renal lacer. Where the... Well, ICU hospitalization isn't available. I know. Where the heck is he? What are we going to do to him? Someone fix him. Open wound and a back injury. That gets emergency care. So, emergency care. Do it. And then give him surgery. Oh, I guess, look, they're just rubbing him gently. This homeopathic version of surgery. Off he goes to... just out the door. Oh. We couldn't look after him. He's gone. Oh, well, that's a bit of a shame. Open wound and that was fine. So we are going to get 52 patients next day. If we can treat them all, we'll be well on the way to getting our next stuff. We should hit this reward and maybe another one after it. And I do feel like I need to add a little bit more stuff here. So the trauma centers have calmed down a bit. Kissing sounds disgusting. Thank you, Daniel. I'm waiting to see if Streamlabs does its alert now. I'm looking very carefully at the join alertee thing. And, oh, it did do it. Daniel just subscribed. Wonderful. I have to be looking at that screen to see it because it doesn't make any noise. I should turn on the noises and make it scream ahoy in my ear, which is what I usually do. It does that for super chats and members. Okay, so that's okay. It would help to have some stuff for this department, like a common room for a med lab. Yes, a technologist, a biochemist. Can we afford it? Can we afford not to is the better question, and I always like to have a reasonable size one. The labs do seem to pay for themselves somewhat. And we're just going to have to go with blue until I figure out, like, changing... No, what is it? Green. Maybe we'll just go for pale... Oh, come here. Pale green rather than the other green. Yeah, that'll do. So, this will be fine. The lab... we'll stick the bin there. This is always a super fun room to jam everything in because there's just so much stuff to fit in usually. Sample storage, glassware, hematology analyzer, a lab shelf because who doesn't want one of those? A lab sink because you gotta wash your hands. Medical centrifuge, a microscope, a PC, a little stool because your people need little stools to wheel around the lab, I figure. And then a whole bunch of extra tables, which we will jab in. Can I? No, I can't actually. Oh, actually, we will put that maybe there. Maybe lab table 1. And we will put a... Do we really need a... Like, printer, lab? Oh, we need 3 more things. I think we can get a table in the middle of the room. Oh, except we got to move this. That's okay. I can move that to here. And then we need this. Oh, no. 1 more table? Yeah, they can walk around. Whoa, we did it. We jammed it all in. That's pretty amazing. I'm pleased with myself. No, not a night doctor. We want a day doctor. So we need a technologist for the day shift. This lab requires a biochemist. Does it really? Does it really? I'm actually going to click on this to see. I think it's just a biochemist. So yes, maybe it did just require a biochemist. I have to do it this way or it won't let me appoint them. Oh no, internal medicine. Oh no, that's for doctors. Technologist, just a biochemist, maybe a bit of cardiology or a USG. Cheap. Senior scientist, a junior scientist. Wow, 98%. Okay. 3 hidden traits. What are they? An alcoholic, people person, and a good boss? You'll do. We like you. Going home for the day? Excellent. Now he's just running away. Fine. And do I want to enclose this place with walls? Maybe. And oh my gosh, look how dirty it is. Ugh. It's just disgusting. You guys just... You're not keeping a very clean shop. One more? Who's the cheapest janitor in there? Early bird. Yeah, we'll take you. Like, you don't have to be brilliant to at least make the place a touch cleaner than it is now. I find it interesting that there's a night shift working here. And, or at least they've just been abandoned there. Is anyone going to look after them? Just, okay, you got abandoned there. And now you're off to sit in the trauma center. Oh, wherever you, where did you go? Yes, no, it was you, wasn't it, with the arm? Sorry, I just had a little cough. And I think, I mean, why are they even in there? They've hurt their arm. And we're just giving them an observation and a bandage. They're going to stay overnight. I don't mind the money, but... Oh, they've left. They've gone home. They've gone for the day. They were finished. Okay, I guess that's all right. Treat one patient. Let's speed up. I don't know why that generalized internal medicine, I don't know why that hasn't come through. I thought we had actually treated someone. 80%, 50%. Long wait. Well, I'm afraid you're going to have to wait, Patricia, because there's no one here in the middle of the night. We just run a skeleton crew. Anonymous Hospital. Do I get to rename that? I don't know where I'm supposed to rename that. Oh. Where's the ambulance? Or is it just our ambulance returning home? Here come the day shift. They're piling in. Can I build a park for employees and customers? Well, I think I can probably build a little park where I think I'm going to build it. I can build it right here. So if I go to my, where is it? Here. So I can have a little smoker's garden. So we can have like a little glass fence across here. So that we don't want to have any riffraff come in, of course. I wonder if they'll actually use it. Double glass doors. Like this. This is a cute idea. I love it. Here. What am I missing? Where's my... I can put in Corinthian columns if I want. Oh, there it is. An outside rubbish bin for all the smokers out there. You disgusting smokers. You know who you are. A pedestrian crossing sign? No. We can put some flowers here, though. Maybe a little splot of flowers there. Maybe a couple of bushes around. I could hedge a flower pot. Yeah, one either side of the door. Palm trees. Can't see them. You just get the stump. Something like that. A roof wall. How does that... Like, I don't quite know how I'm supposed to use that. Oh, a fountain. Like, okay. I guess we can do something like that. And a bench for the smokers to sit and admire themselves. I wonder if anyone's going to use it. Like, I don't know. That seems okay to me. Roof satellite dish. That seems a bit pointless. Is there any other money I can possibly waste? Oh, flower pots. More flower pots. There we go. I don't know. We'll leave that there. There's that. We'll see if anyone uses it. I don't know if they will. Have you gone on? Oh, it's another one of these. We don't know what's wrong with them. Oh, they're having a whole bunch of actions and they're currently being transported. So I think they're being examined. So that's fine. I think you're going to be okay. Little garden is there. Oh, here comes someone. Oh, we just got someone dropped off, I think. On the insurance menu, either click on the name and on hospital. Oh, okay. Or the pencil icon on the top right. Oh. If you've got a name for the hospital, give it to me now. In the comments. Or chat thing. A park. Oh, car park. Well, I think the park is much nicer, even though they just walk. They just leap the fence to come and go from the hospital. Fine. Car park, no need. Everyone walks. This is a friendly European city. It's not America. Don't have to just drive absolutely everywhere. How are they doing? Oh, okay. Treat one patient per day at internal medicine department. Reward hospitalization at medicine. Build and hire as staff. Okay, so we got that. We'll drop some of the spend. And what was the next objective? Treat 5 patients per day for another 2,000. 80% prestige in general surgery. General surgery is doing very well today, so that should be good. It's probably still time to expand. Our Lady of Perpetual Torment. So I do wonder, do we want... I think we do want a little reception here. I have heard anecdotally... No, not emergency. Here we go, internal. I've heard anecdotally that a reception can just generally help your staff. I don't know if it needs to be very big. Yeah, we'll go for the desk. Like... Oh, actually, move that one over. Yeah, I've heard anecdotally that a reception can just help with the, like the rating of the department. I think we only need one secretary, receptionist, nurse. I don't know why it thinks we need fancy chairs. We do not. Let's go like this. Give them a floor and find the cheapest possible receptionist that we can. Oh, we're going to need to put a door in. And over this side we'll have toilets and stuff, I think, in due course. Yeah. But for now, let's give... Oh, actually, that is a good point. We should consider some... I'm going to put some water there. And a vending machine, because we're going to put walls behind there in a second. Cool. So, receptionist. None of those are receptionists. You are nurse specialist? That seems expensive. Now I'm going to take forever to find another one, aren't I? Oh, I am. That's like... Yes, that's way too much money. Just a registered nurse is fine. One hidden trait, don't even mind. Okay, good. So we got a little receptionist there. You haven't seen that happen? I think I've seen it triage at reception before when someone's collapsed. So if someone collapses in reception and there's no receptionist there, I guess they just lie there until someone stumbles across them. But in theory, receptionist is keeping an eye on them, I believe. I think that's how it's supposed to work. So if we filled this in here, we could afford to put in a restroom. Like something like this, which would be a very odd restroom. Now I need to do the floors because, you know, you can't possibly have a restroom without tiny tiles on the floors and a wall. What can I actually fit in here though? Well, I mean, I can easily fit in 3 of those, so that seems fine. And then we'll just do 1, 2, 3, a couple of hand dryers on this side because I do feel bad when I exploit them on the other side. Oh no. Rotate. Does make me feel like a bad cheater person. That's all fine. I'll put in the walls because, you know, I gotta be good to them. You should be able to not put in walls, but just have them like feel really embarrassed. Unless it's that dude who overshares, in which case he's like really happy. Cool. Maybe the flowchart suggests that they're supposed to look at high-risk patients. Huh. Oh, so oh, that is a good point. Well thought out. So, yeah, that is a good point. This space here is private, and that goes for all of them. And I actually don't know why they wouldn't do that already. I mean, surely... I mean, I'll just do that and just make it a decent sized space. So that's emergency. in general, which is upstairs. Patients need to stay out of reception. And downstairs in internal medicine, they also need to just like get out. Don't come in here, patients. It's not your job. So he's actually running tests as well, which I'm pleased about. Okay, so what are you actually being treated for? Oh, I don't know. Ugh. Ugh, that's disgusting as well. Or Crohn's disease. I hope you got the other one, because that one's probably treatable. That's a little bit more annoying. So we got lots of tests available. Okay, so surgery lab, where are you? Well, oh, you're vomiting? Are you just being sent to somewhere? Like, it's not, Well, I think you're okay. I think you're just going to have to wait a second. Where are you now? Oh, you've just, left? Come back. Go to hospitalization or something. Nope, she's gone. She's gone, vomiting her way to home. You marked a waiting room in surgery as off limits. Oh no, did I? The upstairs. Oh, that was very silly. Yeah, they're going to have a hard time waiting, aren't they? So it's actually this one I want off limits. I could probably do the whole room, but maybe I don't want to risk them not coming. Oh yeah, that should fix that. Phew. Okay, so back downstairs, internal medicine. How's it looking? And what quests have we got? Or goals? 5 patients a day. Oh yeah, fine. 2 interns will be great. And we have to wait for the end of the day. And look at that. That is 92%. That's brilliant. Those are all complete. And 50,000 or 50 patients a day, which we're a fair way off. So I think the rating now, like the rating for internal medicine should be, yeah, 4-star. And I think it's because of all this we've put in. Oh, no. Come over here. Cleaning closet. 1 cleaning closet with a door. Restricted area. There you go. No peasants allowed in there. Give them 3 shelves like this. A sink. And we'll go for 3 hampers. It's probably all that's needed except for the floor, which we'll just paint so I remember it's there. And then maybe we'll just hire a really cheap cleaner. Wow, okay, you're fine. And you don't actually have that much to clean. There's, where are we? Where's the specs? Okay, so that's your cleaning area pretty much. I might give you a little bit more corridor to deal with because it's just 1 person. Yeah, that seems fine. And always running tests. Treat 5 patients a day, $20,000 grant. Okay, we're just going to drop that for now. Try and pay down as much loan as possible. And we are going to need to give these staff a common room as well, which is annoying. But we do have quite a lot of space now over this way. Almost wouldn't mind enclosing them as well. They look a little bit... The Wellington Pirate Hospital. I'll go with that. Wellington Piracy. Wellington General Pirate. That's a strange name, but I like it. So this lot. Okay, the day's ending. Day is ending, so that is good news. Come on. Let's rush through to the nighttime. And are we going to hit another trigger? I hope we do. So I'm curious, everyone in chat, what have you lot been playing? I've been playing a lot of this and a bit of Atomic Society, which I'm going to hopefully release an episode on tomorrow. Might be the final episode. I have concerns that I can't go any further. Like, I'm concerned there isn't anything more to it. Good. Interns. And I'm also playing a lot of one Oxygen Not Included because I totally love it. I'm not very good at it, but I'm getting better. All right, well, hospitalization, is it all, there's, no, can we switch you over to, oh, are we actually full? Oh, Like, are we going to have to add... I'm worried we're going to have to add on some more, which isn't the end of the world, but... Long wait for examination. Ugh. Well, we know what's wrong with you, so we're doing hospitalization, IV antibiotics. I mean, that's all you need. It's being done. So just chill out. You're in bed being IV'd, so you should be fine, and then you're going to go to sleep and just, like, leave the hospital. There's no windows in this place either. Are there actually any windows? I don't want to... Actually, I don't know if there are. No windows. Oh no, there are windows, but I don't have any because who knows how big this place will get. Wellington Pirate General. I think I got there pretty much. Wellington General Pirate. Wellington Pirate General. It's a... Yes, everyone who comes through here is... that sounds a little bit more realistic. Everyone who comes through here is in some way connected to the buccaneering trade. $2,000 profit in a day. That should be pretty straightforward. 52 patients due today. So that should hit... Oh, we completed all of those. I mean, then we complete this one. Get 30,000. All right, that's going to be okay. And open an orthopedic clinic. What would that even look like? Orthopedic. So waiting room in a clinic. That's not too bad. I feel like it could go over here. Office in a waiting room. With one doctor? That's easy. Like, and we could stick that over here. That's not hard. Yeah, I'm thinking this way, just in case we want to add more or maybe this way. Heading that direction. Like, what would the prefabs look like for this? So, orthopedic office for 5,000. I quite like using these sometimes just because they're pretty. And you know what? I think we're going to do it. Orthopedic. No, I've got to think about a waiting room as well. I could do a mirror job. Oh, that's a brilliant idea. I should do the same over here. Oh, a brilliant idea. I'm very clever today. That's a pirate submarine. When you hospitalize internal medicine, the demand on general surgery ward does drop. Oh, that is good. You should definitely give your doctors pirate names. Oh, actually, what I should do is give them names after anyone who's playing. So I've already done some of them. If you want a name, then give me an ahoy, and I'll name stuff after you. And I'm very broke. Yes, I am. But that lot of money would be good to have. So I think we can up the money to 300 and just pretend that we're rich. So that was 1, 2, 3, 4, 5. So I'm, where are we? Kind of want to lay out my floor. So we're going like this. No. I'm going to get it wrong. 1, 2, 3, 4. So that's 1, 2, 3, 4. So that's going to be reception, and it goes over 1, 2, 3, 1, 2, 3, 4. Oh, actually, that's remarkably planned of me. 1, 2, 3, 4. Okay, cool. So let me get orthopedic reception underway. Waiting room, sorry. And then behind it is a 1, 2, 3. So the toilet on this side will... come here. I need at least that much more space. We'll just do that for now. Okay, cool. So the toilet is going to be 1, 2, 3. What is that one? It's 1, 2, 3 by quite a bit. So, orthopedic restroom. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. It's going to be that big eventually. So let's just add the 2 more on so that I don't forget. It would actually kind of please me to make this symmetrical, as lame as that possibly sounds, but it really would. Reception. It's just a 3, isn't it? I'll get rid of some walls. Yeah. And that and that. So that reception, 1, 2, 3, 4, 5 should be 5. Okay. 1, 2, 3, 4. Ah, we did it right. Good. 5. And then I want a waiting room which has a, what is it? One of them, a number which we'll put there, a waiting thing there. 1, 2. Then we'll put some other chairs in there as well. Why not? Okay, so this is going to work. This is going to be good. I like it. I'm feeling very bold, fresh. We'll leave that room alone for now. We will put in the PC, the this and the chair. And I think that's a really good point about the red. I have no idea why that's not set, because I have actually seen them wander in there, and I did think that that was a bit silly. Okay, so that's that. We'll need a receptionist. Why is that not accepting staff? I'm thinking. It doesn't really need it, so not accessible for patients missing staff. Could I recruit a receptionist? Doesn't seem that way, but that's fine. I think I'll just leave that, and we'll work on the doctor's office behind it, which is going to be sort of a 4x5. Let's have a look. So the orthopedic office, 4x5, which probably is going to be another tight fit. But we'll give it a go. Give them a door, and everyone can get lost and confused because every piece of the hospital looks like every other piece of the hospital. Oh no, this one is small tiles for the bathroom, white tiles for everything else, and the whole color of the floor tile space will have to change too. We will put a door in on this side, which is a bit weird, but no, it's fine. They'll get used to it. So here we go. I could probably just copy the examination tape. Ooh, weird. I need to probably put that in the, like, you know what? I'm going to just delete that and go for a prefab. If I can not get one that is crazy. That is frankly ridiculous. That one is, where is that? Oh, that machine can go anywhere, really? Oh, that seems ridiculous. What are people saying? Can't have a working station blocked by the red. Oh, I see what you're saying. Can't have a working station blocked by the red zone. Ah, fine. That is unusual to me anyway. So we're going to recruit a nurse. You seem really expensive. Nope. You are a lot cheaper. And I don't care about your hidden traits. And bam. Oh, okay. Okay, well, we'll figure you on day shift. And assign... Oh, I guess I'm going to have to make this a bit bigger. So now assign... I'm going to wait for them to go home and then I'll figure it out tomorrow because I think that's an issue. the machine needs a table. Oh, I see. Okay, so let's get back to fixing this place. I'm going to make my life a little easier. I'm going to give myself a bit more, one more room, one more bit of space. I know it ruins our symmetry, but hey, a lot of hospitals have been a completely chaotic messes. So I'm not sure anyone ever planned for anything to be logical in any of them. And we're gonna live that trend ourselves. So we're going to orthopedic office. Cool. So that will make things a bit easier. It's gonna sit there. I'm going to put in this equipment table here, and we can put. So this one needs a chair or table of some kind. So we'll try an equipment. One of them. What is this thing doing? Machine. Yeah, switch to day shift. I can't get them to switch sometimes. They do this weird thing where if you hire them for a position, if you click on the position, you can't actually get the sun to move. I don't know why that is. It's really annoying. I can put the CPR scan equipment there. And I don't know why. Needs to be attached to another object. Can't be attached to this kind of object. Okay, I'll break out the other, the sample, I guess, the sample room, and we'll figure out. Whoop. You sit there. We'll figure out why it doesn't want to go in that particular space. So that's that. The sample prefab had. Where is it? Orthopedic office. And that machine seems to be weirdly attached to. Where is it? I've lost it. It's sitting on top of a corner table, I think. So let's try that. Corner table, where are you? Like the decent sized table. Which I will put there. There we go. Whew. Oh. Does it need an office chair? That needs this. I can't help but feel that is sort of in the wrong place. Missing equipment. I need to put another chair down now, or another table down now, which is really annoying. So I can move this. I feel like maybe if it was closer. No, it can't be. No, it's not happy. Oh, there's an icon at the bottom of the screen which shifts them. I don't know why that one is unhappy. And now this one as well, you see I can't easily move that. So what did the prefab want? This is where I start getting extremely annoyed because it's not straightforward to figure out. So the prefab here has, it's on a table with 2 stools on it. Is that what it's trying to tell me? One there, and like, so you, it is, it's 2, oh God, it's a 2-person job to look at that. Okay, so you know what, we'll put this in here for now, try and remember it's there. That is slightly annoying. I wish it would tell you, but it's not too bad, not too extremely difficult. Give them an oxygen tank because we're generous. Maybe it'll help someone. And of course, I think we need the traditional potted plant. That one seems a bit ridiculous. That one's a little bit more friendly. Okay, phew. So you know what? I'm going to crack on until dawn so that I can hire during the day. Wow, that was quite a mission. I think I need a... Like, if I did smoke, I would need a cigarette after that. Okay, Kate Foster, I've got a workspace for you. It's daytime. It's the day shift. You know what? I'm just going to do this. Bam. Is it because she's not staff yet she couldn't become staff? I wonder if it's something like that. Because look. I bet you she'll go work there now. Now you... Well, we need orthopediology. An attending, a resident, a specialist, and a resident. 300, 200, 200. Like, I think 9% is a little weak. You seem alright. I'm not even going to bother unlock... Well, should we unlock your traits? An alcoholic. Orthopediology and diagnosis. Orthopediology, orthopedic surgery, and general medicine. You're twice as expensive. We're going to go for the cheap alcoholic. Hooray! We can contract another company to bring people in. Yay! Treat someone. Reach profit. And yeah, we're climbing up the tree here. We don't have walls, but everything else is going beautifully. And there was some binging. I don't know what it was. Okay, I think... what we're going to do... We're going to do toilets for this, weren't we? This was missing equipment. So... can we just do that one? I think we can. So I do like this feature. I wish I could figure out how to save. I don't know how to save prefabs, but I can just plop this bad boy down. Except I don't really want the door there, but we'll figure that out in a moment. God. Alright, no. It would have been quicker just to do it myself. Okay, yep. You go there. I just... And take that one. I don't know, we need to give our nurse her own very private door. To the, okay, come here. To the bathroom. That seems a little bit of overkill. I mean, she might have bowel problems for all I know, but that's just getting ridiculous. And the last one there, and that one here, and I know there's one there, and there's a door there. Did we? No, we didn't weirdly double up. Oh, we already put a door in ourselves. Okay, cool. So all that should be working. Yeah, and that's working. I think it's like she's not employed, so she couldn't go there until she was employed. Bacteriogastroenteritis. Ugh. So she's being looked after. Rehydration. Oh, she's on the ground. Linda, come back to us. Your lupus will be cured. There's no free bed required for hospitalization. Where are they trying to send her? TC hospitalization. Are we that short? Well, look, there's a TC. Those are free. You guys get off your backsides, and it's looking pretty bad for her, to be honest. Transported to another hospital. I don't understand why. Oh, we were doing her just fine. Hospitalized, and now where is she? No, she's being wheeled away. Nope, gone. Another one. This one's monitored, so got stabbed or something. Okay, so got damaged and stabbed, and they're currently, I feel like, handing you over to the specialist. Can't be hospitalized. Why not? Oh, we haven't got ICU. Well, I'm sorry we don't have ICU. I spent all me money just like getting this lot sorted, and now you want an ICU as well. That's just ridiculous. We might hit 50 patients a day though today. And we might hit 2,000, and we'll definitely hit those things. Okay, cool. So build a higher staff for one sonography unit. Really? That's oh my god. What have they been doing in here? That's kind of disgusting and gross. I think we can do the sonography. That's not going to be too hard. And I do like to make my 5. What is this one? 1, 2, 3, 4, 5. 1, 2, 3. 1, 2, 3, 4, 5. I think we can just do 5 by 5. And if we were to go corridor for orthopedic, it would be like this. Why am I not seeing orthopedic? Oh, it's because, well, never mind. We could do the lab. Now, what does it need? Anything special? Actually, looks like it needs less stuff than the other room, which is good. I was going to just copy and paste the whole thing over. But if it needs less stuff, that is going to make things a lot cheaper to run. And a white floor for now. I'm going to come around and color these probably all off air because it's not the most exciting thing to do on a stream. Says the guy playing this very strange game. That goes in. Then it's just all the... Actually, no, it does look like it's about the same amount of gear, to be perfectly frank. I should have just copied something over, but never mind. Microscope. Sample storage. Yeah. PC. A printer. An RIA. Actually, no, maybe not. And a lab chair. And now we need someone to hire. Technologist. Hiring during the day is definitely easier. So what do they need for this? I think we can get away with just about... I think it's just biochem. Let me have a look. Oh, it says ultrasound on this side. But the technologist on this side just needs biochem. So they don't need to be fancy. You are a slow learner and unpleasant. Well, I'm afraid we're not hiring you. You are comforting and gamer, which is good. Junior scientist. Bam. And what's that? You've been streaming this on your mobile for over an hour and just realized you've been on 4G. Oh no. Oh dear. I've been watching Oxygen Not Included streams like that. And it hurts, doesn't it? Yeah, it's not good. Corridor. Why is this not an orthopedic corridor? I don't know. Probably because it's an emergency corridor. That's why. Oh, that's a shame. I can't just delete some of it. I deleted all of it. That's annoying. So yeah, I have done exactly this. I've deleted all the corridors. I've done exactly the same thing, Joshua. Oh, Jacob, sorry, and it really hurts spending all that data, and you think you're not using all your own data, and bam, you are. Better spec this out, or they will not clean. Come down here, then up here, then here. That one's not their concern, so come across to orthopedology, diddly, and no, not reception. Corridor. Don't have any cleaners yet, but we can slap one in over here. And we can sort the floor out. But we will get cleaned anyway. The cleaners will come round if they've got the time. To our open air clinic. Oh, look. They're supposed to be looking at the computer. No clear diagnosis. Consider... What? Oh, no. Oh. Consider adding... I'm not adding an MRI so someone can get tennis elbow and pay me like diddly. I'm going to send them back here and give them to Kate Foster and give them a differential diagnosis. So I do think that feature's kind of cool, flipping them over to different departments. You're coming over here, you're going to have a look. Differential diagnosis. We're not putting an MRI in, that's for bloomin' short. Okay, we should be reducing our debt as much as we can. What do you say, MRI specialist? Okay, actually, that's a good question. What are we like on waiting times here in general? 11. That's crazy. We need more doctors. We need, I would say, at least 2 officers. Where's our lab? People aren't really using that. We need at least 2. And everything else is okay. Oh, 4 people waiting on the lab. We need at least 2 doctors, and I'd say another lab. That's one of the reasons why we're not hitting 50. I'd say people are just running out of time. Did we finish the... No, differential diagnosis is going on, so that's fine. Let's see what happens to her. Limited arm motion, hand pain, and a hidden symptom. We'll finish this. You know, this is going to have to be like a doctor here, 2 doctors here, back to back, and maybe over here too. Oh wait, we got 50 patients. Got a $30,000 grant. Nice. We must have got some other grant as well. Pay down the loan. Don't really want to, but oh, we're back to James Garcia now for differential diagnosis and a physical examination. Tennis elbow. We did it. What is the cure for that? Proliferation therapy. Some recommendations, and off you go. A happy customer to the tune of $630. Hire a night shift lab tech. That's actually not a silly idea. Will they actually work at night? You obviously think so. So, night shift, there's none. So now we'll look for a night shift loving tech. A junior scientist seems cheap. What are your traits? Oh, loyal and unpleasant. But they're going to be on at night when no one's around, so we'll hire them. I want to see if they do actually come in and do tests. Unlimited 4G? I wish I had that. I could if I paid more. Anyway, you know what, guys? It's 11:15 and it's getting pretty late here. I think I'm going to end the stream here. Thank you very much for watching. It's been fantastic having you all around. I do plan to stream this again. I'll schedule it up so you can do the bell thing on the channel, or just see when it's coming up with your subscriptions, or hop on Discord and I tell people then as well. So all of those options are available to you, and we'll continue expanding this beautiful hospital. And thanks very much to all of you for watching, especially to Ethan Colt Games, a joined member, as well as Lawrence Ellis for your fantastic advice in chat. I think we're looking not too terrible, and I think we're going to hit these pretty promptly. Build and hire stuff. Oh, we didn't actually build the sonography. Did we build a sonography, or did we build a general lab? We built a med lab. We didn't actually build the sonography. That's fine. Where's what? Med lab. Where's the? There is no. I'm confused. Never mind. I'll worry about that tomorrow. Oh, Sarah Tatch, I'm sorry you've just joined. We will have the stream up as soon as it's finished processing. It takes a couple of hours. You can always catch up on the first stream, which was a couple of days ago. It's on the channel. And then you can watch this one as well and get some good hospital building. Anyway, until next time, thank you very much, everyone. I'll hang around and chat for a second. Good night.